I'm going to just ask you a few questions regarding the conference theme, which is value-based care.
Right.
The first question is how technology can assist in delivering value-based care, and secondly, in relation to that, we talk about personalized, customized care and how technology plays an important role, and how Napier, as a tech provider for healthcare, is able to assist in these areas.
Sure. So let me take the first one, which is how do you uncover value gaps using technology? I think technology does a few things. One is it can stitch information seamlessly across all the enterprise stakeholders and deliver timely information to them. And then they can then, based on that information, take intervention and appropriate steps to deliver care or coordinate the activities within the enterprise. So I think the key is technology enabling us to unlock the value gaps. So let me give you an example. In the past, I would say almost about 10 years ago, when the electronic medical records were not very popular, doctors still delivered care, but many a times a patient would forget to talk about their past medication or past issues, and that was always a gap. But then when the electronic medical records were more popular and were implemented in many hospitals, all of a sudden the physician had a longitudinal view across the entire person's life of the various episodes of care for which they had been to a hospital. And that's kind of how value gaps are unlocked using technology. So you look at some information that's missing. From there, you stitch the technology together to provide that information. The second and more crucial and important value gap that can be uncovered by technology is talking about insights. Information is only one part, but insight is more important than information, which is why today you have artificial intelligence. Artificial intelligence essentially is talking about, let me give you an insight so that you can then decide what to do with it. So that's why AI and the technology all come together. So I think that's the first question of unlocking and uncovering value gaps and how technology broadly helps. Your second question was more about how can I personalize care, right? So if I take, for example, the elder care sector, we were talking about it earlier on. In the elder care sector, care is always delivered to a resident in a residential care facility like a nursing home, or in the case of a patient at home, which is a home care or a daycare or retirement villages or any of these. The care is usually for an elderly, coordinated through what is known as a multidisciplinary care team. Because you need some physios, you need some physicians, you need a nurse, you probably need someone who does wound dressing for the diabetic patient and so on. And that multidisciplinary care team then allows you to personalize it. So I think that's one way in which healthcare providers do that. The way the technology enables that is I could create a care plan for a diabetic person, and the same care plan needs to be customized for another diabetic patient because they have other comorbidities. So in addition to diabetes, they might have blood pressure, they might have an asthma or whatever. How do I take the same diabetes care plan and how do I customize it to the others and yet retain uniformity or consistency in healthcare services delivery? So I think that's the second part about how you can use technology to personalize. Now there is a slightly contentious area which is also becoming more prevalent, especially in the US, where you have a personalized health record. The question is, does my health data belong to me or does it belong to the government? And I think that therein is the contention that we are trying to resolve. But it doesn't take away the fact that the patient at any point in time must have the ability to present to the doctor their medical records. Whether you allow them to do it through their mobile or you allow them to do it through a central facility that the Ministry of Health in every country has is a moot point. But that is where you personalize that. And you can take this one step further and talk about personal medicine, which is based on how do I do a DNA sequencing and find out which cancer treatment will be more effective for one patient versus the other. So that's how personalization in medicine and personalization in healthcare is headed. And that's kind of what we are looking to do with personalizing care using technology. The last question I think was, what is Napier doing all of this, right? So we have a few technology solutions which allows Napier to deliver what I call as care anywhere. I think the days are gone when people were almost expecting that I must go to a hospital to deliver care, to get care delivered to me rather. But now what's happening is a patient recognizes all of a sudden that, hey, I'm paying money, whether out of my pocket or through my insurance or through anything else. So the service provider, you better watch out and give me the care the way I want it, not the way you want it. You set up your nice hospital, you put all those things, that's good for you, good on you. But I don't want to come there, especially in the case of an elderly patient, because there is a risk of transmitted infection when they go to the facility. All the more they don't want. Or in the case of, let's say, an elderly lady who has osteoporosis and arthritis and those kind of conditions, they are going to have to walk up and down and across the length and breadth of the hospital, which they really don't want to do. So what we are now saying is, how do I deliver technology in a way that I can allow them to be cared for wherever they are? So things like telemedicine, things like remote patient management, things like care plans at the enterprise level. So these are all the ways in which we are delivering care everywhere, allowing the providers to deliver care everywhere.
So you're basically giving a platform
yes.
for your providers to deliver care
pretty
in
much.
a much more efficient, personalized way.
And also the other thing that we are doing is, for example, we spoke of the AI. So one of the AI chatbots we have is, it allows basically a nurse to save a minute or so in every task. So over a period of a day, the nurse can actually save about an hour or an hour and 10-20 minutes on their daily activities. Suddenly there is a productivity boost without having to put more nurses on the jobs or without having to create a new facility or infrastructure. So technology can be really harnessed in more creative ways than people would care to imagine at this point in time. That's why we exist.